Welcome back to our next session. This is our second theme, which is about wearables and apps. And there's a poll running at the moment, so do keep your answers coming in, and we'll take a look at that before I introduce the speakers. We've got 4 excellent speakers who are going to look at different aspects, very different aspects, in fact, of using wearables and apps from very different perspectives. I'm Hilary Pinnock. I am a GP by background, a family physician in Whitstable, Kent, and I am the Professor of Primary Care Respiratory Medicine at the University of Edinburgh. And I've had a long-standing interest in how we deliver care, and of course in today's world that is including digital options. So this is a really interesting session for me. I am also in the ERS. I also head the clinical assembly 1. So I come from a very clinical background, and we're very interested to hear what our speakers have to say. And I'm just looking at the poll, and something like half of the people who have responded don't actually use wearables at the moment, it says here. Exercise trackers seem to be the most popular. Respiratory variable monitors and sleep monitors following on, with some cardiology following on at the bottom. So interesting. The results are changing a little, and I'm sure by the time we've got to the end of this session, we shall know so much more about wearables that we will all be wanting to use them. So I'm going to start by introducing Andrea Aliverti, who is the Professor of Bioengineering at the University of Milan. His interest is in wearable technology and how this can be used in respiratory care. He also has been head of one of the ERS assemblies, particularly around sleep and breathing disorders. So, Andrea, we're very much looking forward to the state-of-the-art wearables that you can tell us about.
Thank you, Hilary. I hope you can hear me. Okay, I thank you, the organizer of this summit. I'm very glad to make an introduction to patient wearables. Which is the state-of-the-art of patient wearables. The outline of my presentation is the following. First of all, we are going to see very briefly what does it mean a wearable device. It seems to be a very simple question, but we have to be very clear about that, and also about what does it mean more specifically wearable biomedical device. Then I will briefly introduce what is a digital health ecosystem, how it can be defined. Then what and how is now possible to measure, to assess, particularly in terms of respiratory function. And finally, we will see how effective are patient wearables nowadays in different fields. First of all, what is a wearable device? This is quite an obvious question. Wearable means whatever a subject, a patient can wear, including sweaters, hats, pants, so everything that can be worn by the subject, and that does not interfere with the normal daily activities. That's very important. Portable is not the same as wearable. Wearable means that when we have such a device worn on ourselves or on a patient, we basically forget about it. So the concept of wearability is very important for monitoring, for well-being and fitness sport. As you can see here, we have nowadays, as we all know, a very large availability of different devices and different technologies also. We can basically subdivide the current technology into two main parts. The first is the one based on conventional, let's say, rigid electronics. An example is the smartwatch, as you can see here, in which the normal and the, let's say, traditional electronics is used. And the second kind of wearables are more based on more disruptive technology, soft technology, including for example, textiles, including garments, including soft and stretchable sensors that can be attached to the body, patches, and so on. So this is, of course, I would say the current, but more, first of all, also the next level of technology that will be used. And in fact, we can observe such a trend in the technology. We are now clearly passing from the period in which we had lab measurements through portable devices like the ones that you can see here, in which again we have such devices like halters or portable metabolimeters that are really wearable because they can interfere with the normal activities and can be used only for short periods of time. In the last year, we have observed the development of wearable devices, as I said, but then we go into flexible and textile and e-tattoos, so attachable devices, and so embedding sensors over the skin or just below the skin, or also there are several labs in the world developing implantable devices under skin or within contact lenses or just below the skin, and even more ingestible devices. So we have different levels in which we can obtain measurements. Sorry about that. And the point, as I was telling you, is to understand which ones of these wearables can be considered biomedical sensors, so medical devices, certified medical devices. This is the point. I just want to remind you that few days ago, the new regulation for medical devices is fully applied in Europe. Okay, so this is very important in the field of wearable because it will constitute the basis of making this important passage from, let's say, gadgets or devices that are used for, let's say, personal use, and considering them not only as gadget, but eventually as medical devices. So with a specific pre- and post-market requirements and the certification released after a proper evaluation. It will mean to certify, is already meaning to certify not just the sensor and the device itself, but the overall system, for example, for telemonitoring, that is constituted by the so-called body area network, in which we have the sensors measuring different physiological parameters on the subject, and also the first level of connection with the gateway, that typically is the smartphone, and the second level of connection between the gateway and the service center. that it basically is based on cellular link technologies. So the certification includes the measurement device, but also the connection, the app, and the software that has to guarantee the privacy of the subject and also the interoperability of the data provided by the device and the system with other eventually records. And that's brings to the definition of the digital health ecosystem, in which this model of mobile health is integrated in. So digital health ecosystem means basically a patient-centric model in which we have the device, we have the app, we have the connection with the service center, and this has to guarantee, and this is very important, the interoperability with electronic health records. So let's now go to the next step, what we can measure. First of all, regarding cardiac function, we have seen a development, a huge development of techniques based on photoplethysmography, PPG, that allows for sure to measure with high accuracy heart rate at rest, heart rate variability, but is opening up also the possibility to have information about oxygen saturation and also pulse-based parameters with high accuracy, and also in positions not so peripheral like the finger, but for example at the wrist. We have ECG systems that provide medical grade ECG integrated eventually with a smartwatch, and these are examples of devices that have been certified by FDA. Then we have when we talk about the pulse oximetry, related to what I said before, we can say that we have really now the development of different possible locations where to position our optical system to measure oxygen saturation. And as you can see, we have basically the locations that are close to the wrist, and so we are going from the fingers to the wrist, again with different level of accuracy that is still to be evaluated in some cases, but some interesting solutions are now coming out, for example, that do not interfere very much with daily life activity, and these systems are only in part already certified. In terms of physical activity and actigraphy, the basic sensor is accelerometers, or inertial sensor that provides step counts, speeds, and rate time. But also barometers and GPS system allows to obtain different measurements that are useful to detect and to estimate the level of patient's activity. The problem is to measure respiratory parameters, including, for example, respiratory rate and tidal volume. This is not a trivial problem, not completely solved. I just want to give you some small samples of what we can do. This is a system that measures basically respiratory rate with high accuracy through the use of this belt with embedded a variable resistance. And here is an example of combining activity, for example, different postures and different activity recognized by artificial intelligence algorithm with the values of respiratory rate and tidal volume. So this can provide an example of how much is important to combine multiple measurements to obtain parameters that are related to the level of activity and to the posture that the patient assumes. This is another example of integrating different sensors, not only on the body, but also in the environment. So, for example, with the environmental sensor and air quality measurement systems at home, and so showing the variability of respiratory rate with respect to the changes of environmental parameters. This is another example of having different measurements on the body, now based on garments embedding ECG, medical grade, and respiratory rate and amplitude, so tidal volumes, both during normal daily activities and during sleep. So this kind of devices opens new perspectives in assessing sleep with very low level of intrusivity with respect to the subject. Very briefly, what can we do with such devices? COVID, for example, there are now several papers showing that combining different measurements, of course, with these studies are retrospective, but combining different measurements taken with wearables, it allows to identify early, with 4 or 5 days, the onset of symptoms. For example, considering the increase in heart rate, respiratory rate, normalized with the level of activity. COPD exacerbation is another example in which we need study. We have some preliminary data, very promising, but of course we need much more well-designed clinical trials in order to identify how wearables can be useful in order to identify early signs of exacerbations. Asthma, the use of this kind of devices together with apps allows to particularly to help patients in education, symptom trackings, environmental alert, and medical reminders. But again, efficacy has still to be demonstrated. Sleep is, as I mentioned before, another example in which wearables will allow to pass from very cumbersome systems like the one that you see here on the left to really obstructive systems like the one on the right. Neuromuscular disorders, this is an example of studying in which patients with Duchenne muscular dystrophy were monitored all day during their activities, showing that, for example, respiratory rate is a clear indication of the status of the patient. So respiratory rate is frequently forgotten, can be measured through, for example, the use of small sensor placed on the skin. And finally, I would like to finish my short presentation with some ideas and conclusions. First of all, the large development of consumer-grade wearable sensor are now expanding the possibilities of having a good remote patient monitoring systems for early diagnosis, for recognition of early signs and real-time disease management. we still need the development of solution providing medical grade measurements, and this is extremely important to have medical devices, not just devices. Third, we have the point that this kind of remote monitoring basically is the cornerstone of a patient-centric healthcare model. So we are really observing the possibility to change the model of, let's say, also patient assistance and monitoring. And finally, as I mentioned, we are in the position now of designing studies to study real effectiveness of these solutions for our patients' benefit. And thank you for your attention.
Okay. Thanks very much, Andrea. That was a really interesting and exciting look through some of the technology, some of which I think is already beginning to be used and some of which I think is very much for the future. I hope everybody who's watching this is actually writing in some questions and perhaps some comments. We'd be really interested to hear how you see this shaping our future management of people with respiratory care, with respiratory diseases. So thank you, Andrea. That was a really good start to this theme of wearables and apps. I'm now delighted to be introducing Ioannis Vogiatsis, who is from Newcastle, Northumbria University. Ioannis is, his expertise is in pulmonary rehabilitation for respiratory disease. He has been authoring many of our ATS ERS standards and task forces, and he's currently the Secretary of Assembly 1. So Ioannis, you're going to be telling us about how we can use these wearables in sports for elite athletes. I'm looking forward to hearing this. Thanks.
Good morning, Hilary. I'm very pleased joining you this morning. So as I'm waiting for my slides, great. So these are the objectives of my presentation. First, I would like to review current developments in the use of wearable technology to enhance elite sport performance. Second, to address issues of quality assurance and data standardization for consumer sport and fitness wearables. And also, I would like to talk about lessons to be learned from sports medicine for establishing a global standard for wearable devices in sport and fitness. I would like to start with an initiative jointly undertaken by the International Olympic Committee and the International Federation of Sports Medicine to protect the health of the clean athlete in Tokyo Olympics and to assess the effect of the weather conditions on performance during competition. Tokyo is expected to be among the hottest venues in modern history, thereby increasing the chances for exertional heat illness. With this in mind, research for the development of wearable cooling technologies and real-time environment and core temperature monitoring is high in the agenda of the International Olympic Committee. The wearable technology that's going to be used in Tokyo Olympics was developed as part of the Sub 2 Hours Marathon project, using the Sub 2 Hours mobile application to collect a range of data during training and competition. The technology applied provided live feedback of land, air, and core temperature, and a range of physiological and biomechanical parameters facilitated via a cloud portal. The prototype system that is going to be used during the Tokyo Olympic Games allows for a substantial number of variables to be gathered in real time via wearable technology, including heart rate, body and land temperature, humidity, running cadence, and bioenergetics. Wearable technology for sport and fitness is advancing quickly with the application of wireless foot-worn inertial and insole pressure sensors for gait pattern analysis to evaluate running economy. Running economy refers to a relatively low fraction of maximal oxygen uptake sustained at a given running speed. Scientists have identified an association between gait patterns and oxygen uptake during running, thus better understanding variations in running economy among runners. Today, there is a great deal of development of miniaturized sensors built in running shoes to monitor and transmit data on biomechanical parameters. There is also a great deal of development of lab-on-skin technology, allowing measurements of metabolites and electrolytes during training and competition. A lab-on-skin takes advantage of the fact that the skin is the largest organ of the human body and an ideal surface for unobstructed access to vital biological signals from inner organs, blood vessels, and the muscles. Emerging prototype systems that could be used during training and competition, like this one, allow for a substantial number of variables to be gathered in real time via wearable technology, including heart rate, body and lung temperature, humidity, running cadence, bioenergetics, metabolites, and electrolytes. This is an overview of the wearable market as defined by wearable technologies. On the left, you see the medically certified devices, and on the right, the sport gadgets and fitness trackers. In the middle are the so-called secondary healthcare market, including several products categorized in between, as their measuring accuracy and reliability may be very high, but they are not certified. However, as they save the time for the certification process, they are often closer to the consumer and athlete's needs. Experts from the International Federation of Sports Medicine seek to develop a guiding reference on wearables together with wearable technologies for the unregulated sector. This is an overview of the major concerns in the sector of wearables that the International Federation of Sports Medicine is currently addressing. These are the following. First, quality assurance. For example, some wearables lack of accuracy in estimating energy expenditure or measuring step counts. Second, population-specific validation, meaning that the validity of a measure, such as step count, is certified to a specific population. This is important when considering, for example, that gait patterns vary widely between healthy people and those with neurological disorders. Third factor, privacy. For example, personal information like GPS location can be hacked. Then, data interpretation and presentation to consumers. For example, people will obsessively wake up at night to check their sleep watch statistics. And finally, standardization of data for technical purposes, acknowledging that devices have different units, timescales, and coding languages. This makes it difficult to facilitate research, encourage market competition, and allow devices to interoperate. The International Federation of Sports Medicine and the European Federation of Sports Medicine Associations are working together in establishing a central resource at sports medicine accredited laboratories that could evaluate consumer sport and fitness wearables for quality and/or data standardization in order to guide companies to achieve these aspects, but also educate researchers and consumers to critically consider them. The International Federation of Sports Medicine and the European Federation of Sports Medicine Association held last year 2 stakeholder panel consultations for the implementation of a global standard for wearables in sport and fitness. 2 virtual panels were convened for formative discussions among industry and academic stakeholders, including a representative from the ERS Digital Health Working Group. The panel consultations were about, first, the key facilitators and barriers to participation by sport and fitness wearable manufacturers, and second, the stakeholder priorities. The venues were the Yale Center for Biomedical Data Science Digital Health Monthly Seminar Series and the New England chapter of the American College of Sports Medicine annual meeting. In regards to stakeholder priorities, the panel thought that quality assurance of wearable devices was the highest priority compared to data standardization and interoperability of devices with electronic health records and with other wearable devices, because, as it was noted, without high-quality data, other priorities are not meaningful. The virtual panel event served as part of a wider consultation process for the International Federation of Sports Medicine to refine its roadmap towards full implementation of a global standard for wearables in sport and fitness. Here is the International Federation of Sports Medicine roadmap, initially setting a guiding reference steering group, leading to a guiding reference center for wearable devices, and subsequently testing of standard operation procedures with devices from small companies. You can see here on the left of the roadmap implementation testing of 2 to 3 devices at Tokyo Olympic Games in July and August 2021, as discussed earlier. The roadmap aims to make the International Federation of Sports Medicine central resource accessible to larger companies for benchtop and field testing. From the ERS Digital Health Working Group perspective, it is useful to follow these developments in commercial sport and fitness wearables for establishing a standard for implementation and consider whether a similar roadmap could be adopted in the future specifically for respiratory patients. Several research teams in Europe have contributed to large-scale projects, such as the EU IMI-funded Proactive and LISD projects, investigating the validity and reliability of wearables on respiratory patients, and can therefore jointly serve as a central testing resource for wearable devices applicable to respiratory patients. I would like to acknowledge the expertise and material provided to me by Professor Yannis Pitsiladis and Professor Garrett Ars for preparing this presentation. Yannis was the head of the Sub 2 Hours Marathon project, and he is leading the Beat the Heat project in Tokyo Olympics in his capacity as a member of the IOC Medical and Scientific Commission and chair of the Scientific Commission of the International Federation of Sports Medicine. Garrett is affiliated to Yale University, and he's leading the discussions for a global standard in wearables in sport and fitness with academics from the American College of Sports Medicine, but also with wearable industry stakeholders. The perspectives from the academic and industry stakeholders are expected to be published this year in the Journal of Sports Medicine, and I'm very glad that I have contributed to these consultations and to this manuscript representing the ERS Digital Health Working Group. This is the end of my presentation, and now I would like to share with you a video showing high-performance athletes using wearable technology as part of the Sub 2 Hours Marathon project during training and competition, to hear the views of these athletes and their coaches concerning the use of wearable technology. Thank you very much for listening. If we can have the video now, please.
Distance is 11.7 kilometers, and the last kilometer, 3:13 to 42 minutes 26 seconds. That's the total time.
This watch is easy to use. It's measuring kilometers, time pacing, total time, average pace.
As a coach, I'm really excited. I'm very, very excited because of this new technology. We have so many features in it, and also gets the record of the athlete as per the distance and the time, and it records again, it shows the altitude and the temperature as well.
Real innovations of 2017 was developing real-time reporting of what the athlete was experiencing during training initially and then during competition.
Se ajusta previo al entrenamiento, a la carrera. Tú decides el ritmo al que vas a entrenar o competir y se ajusta todos los parámetros para que cada determinado ritmo te lo marque. Se puede visualizar en color con una esfera alrededor del reloj Vodafone. Puedes girar y en un momento ver si vas en el tiempo predeterminado.
El proceso de diseño es fundamental contar con feedback, con ideas tanto por parte de los atletas, de qué es útil para ellos visualizar, como casi sobre todo por parte del equipo científico que rodea a los atletas. Tenemos un grupo de keniatas entrenando estos días.
For example, looking at nutrition. What is going to be the individualized diet? And that's a big theme of this project, the individual rather than the average. We are now developing the sensors to actually send the information to the watch to make it even smarter and therefore making us smarter. And that knowledge is going to revolutionize the way we prepare our athletes and actually how we actually have our athletes compete.
Parece que la temperatura del core está muy relacionada con tener una deriva aeróbica en tu sistema y por lo tanto una pérdida de performance. Pues no es ni más ni menos que una píldora como esta. Es un termómetro con un transpondedor Bluetooth. Esto transmite la información a un parche pegado a tu piel y el parche al reloj y el reloj a nuestro dashboard. Al fin y al cabo, aplicar la ciencia para ayudar a los atletas.
Parece que lo que hay de toda la vida ya lo hemos controlado y las nuevas tecnologías, tanto en calzado como en este tipo de relojes, son lo que van a ayudar a que esos récords del mundo se sigan batiendo.
Our design hasn't changed a lot in 200,000 years, but the world has dramatically changed, especially in the last 1,000 years. And so this project is also aimed at looking at that.
Thanks, Ioannis. That was a really interesting insight into what wearables can do for elite athletes. Really fascinating. Now we're going to move on to something that's affected us all over the last year, COVID tracing apps. And I'm delighted to introduce my colleague, Vitaly Proborets from Ukraine. Vitaly is leading the ERS group on e-health digital technologies. And he's going to tell us about contact tracing apps. So over to you, Vitaly.
Thanks, Hillary. It's a great pleasure to be today with you and to present this information to our participants and such a nice audience. So I'm not sure I can see my presentation right now. So sorry, I can. Yes, finally I can see. So today I would like to talk about contact tracing apps and especially about lessons that we learned from these apps. So as you see on these apps on the slide, there are a lot of national apps for tracing patients with COVID-19 across Europe. And but if you not use this one, at least you know about such examples of these apps. But let's start with basically with a definition. So what does it mean, contact tracing app? So according to the definition, it's a mobile solution that can detect and trace other app-carrying individual. So when you talk about COVID-19, these apps can help to break the chain of coronavirus infection nationally and across the border. So it's very important to understand how to establish these apps in different countries. So let's start. First of all, we have to understand how these apps work. So what are the main technologies which allows us to work through these apps? Basically, there are several possibilities. So these apps may use whether Bluetooth low energy technology, it could use GPS technology. In some cases, may use Wi-Fi or ultra-wideband technology. However, the most commonly used one are Bluetooth Low Energy technology, which provides us the most important opportunities to track the context between two persons who can have contact. So the main idea is that when two persons who are using the same app, they locate in some particular distance between each other for a particular period of time. Their devices are interchanging some specific code which will be located on these devices and for a long period of time. And if we will find out that someone have contact with a patient who was positive COVID-19 or have positive test for this, other patients will receive notification. And if you talk about storage information, so basically there are two ways how to storage the information, decentralized model and centralized model. So if you talk about decentralized model, information about context of person are located only on the smartphones of each other person, and health officials are not able to retrieve this data. However, in centralized model, we have more opportunity to receive more information about this context because data are stored in specific centers. But of course, there are much more concerns about privacy in this case. So what stops us from rapid and implementation of contact tracing apps throughout the world? First of all, the first issue is the lack of access to smartphones due to different factors such as social, economical status, residency status, or age. So if you see, despite the fact that the number of smartphones are gradually increasing through different last years, still there are some countries where a number of smartphone owners are less than half. And especially these countries are vulnerable and not able to implement this intervention. If you talk about other factors, so many countries find out that low income level is associated with low smartphone usage, and as a result, so no ability to use these apps. If you take into account usage by the age, as you see on the red line, so this number of smartphone users in US in persons over 65 years, and you see that despite the fact that this number is growing, still there's a great difference between younger users and elderly one. So, and nice information is presented from our researchers from Singapore, who just trying to assess other portable equipment using by different age groups like laptops, smartphones, tablets, some different wearable devices. So you see that even in this comparison, children over between 6 to 14 years, so they use more wearable technologies than persons over 60 years. So once again, this is a great risk for this parent. So how to face this issue and how we cope with this? The solution is to create a contact tracing wearables, which are rapidly involved in different countries. So this wearables is a physical device that can exchange Bluetooth signals with other wearables or mobile apps nearby. So they are suggested for those who do not have smartphone or do not prefer to use smartphone, because and as you see, so it's really nice devices which provides opportunity for those who can't use contact tracing apps. And if we think wider about different patients with different chronic lung diseases, we may understand that we may use such simple devices, some wearables, to improve management of different patients. So personally, I face a lot of patients with COPD who have problems with filling questionnaire apps to monitor symptoms. And this is a nice research by our colleagues from Midlands, where they combine this app questionnaire with Fitbit to monitor daily activity of the patients. So if patient faced with a problem, and you know that this patient has a low digital literacy and health literacy, so apparently this patient is possible candidate to implement some wearable device. Another issue which stops us from rapid digitalization is insufficient public uptake. So there are a lot of rumors around COVID tracing apps in different countries. And first of all, people face with lack of information and misconceptions about COVID-19. Also, there are a lot of concerns about privacy. So people really think that it's like a big brother watching you, where you're going, with whom you're talking, and where you just had your dinner. So, and it's a really issue. People are afraid of using such apps. Another concern is concerns over stigma. So to be embarrassed by others that you are afraid of COVID or you are suspicious of COVID. So for some persons, it's really important. And of course, there are some concerns about uptake. So people really think that when all others start using this apps, no social distance, no masks, so and it will just get worse because of these apps. To face this problem, the solution is to use a co-creation process when we create these apps. Co-creation means involve all stakeholders in the process of development of the app. So both researchers, health professionals, and users, so patients or all other citizens, if you talk about COVID-19 software developers, so and to use an iterative process of co-creation. So with very regular gathering feedback during all the stages of this creation of this app, for instance, so we talk about that. And it's very important to collect the user experience. And I here present you some example how to use. So we use a honeycomb model by Wearable, which allows us to understand how this patient evaluate this implementation as a credible, desirable, useful, and because we want to create an app the patient and a person will recommend to all his relatives, to his friends. So this app will not force people to use this contact tracing app, but people want to use this. So that's how we could do this. And example how this co-creation process may be used is from this nice research where researchers try to implement pulmonary rehabilitation using this methodology. So of course you may use different methodologies, both action research, participatory action research, but the main issue is that we must first of all maybe once again iterative process with regularly gathering feedback from all the end users and all the stakeholders. So to build a sustainable contact tracing app system, we must first of all focus on cybersecurity, privacy of and data protection. As we decided, it's a great concern for end users. So European Commission provides us with some tips how to do this. So first of all, we must focus on data minimization. So we must gather only the most important information that we need for to stop coronavirus and not gather anything else. To prevent tracing where people's movements, we must use only Bluetooth low energy technology or other technologies with the same mechanisms which are not tracing where patient was being. And of course, data should not be stored for as long a period as we need and must be protected throughout the state-of-art techniques. And also persons who use this data must use them secure and confidentially. So if we talk about data interoperability, it's very important because we want to build apps that will gather material information, data that we may use for other purposes. And if we talk about COVID-19 tracing apps, we must ask two questions. Can this app already talk with another app? Or there is potential interoperability for this app. And if you look on the slide, so this is information about national contact tracing apps, which is different European countries. See that most of them are whether at this moment can already talk to another app or has potential interoperability. Only few are not potentially interoperable. It's very important because we want to build not just one app which interacts information with other app users. We want to build a system internationally across the borders where different apps can interact information between each other and with different wearable devices. So it must be interoperable. And if we talk about patients with other chronic lung diseases, we also use this idea of data interoperability to build a system where data which are collected can be easily used by all other specialists and for other purposes of public health or in hospitals. So whenever we need this, without spending our precious time, spending our precious resources to change this data for appropriate way. So I hope this information was at least interesting to you. I hope not sleeping. Unfortunately, this online meeting, I can't see your faces and I can react to this non-verbal signs from you that Vitaly, it's time to stop this. So, but at least if we were really pleasant, if you have some questions, I would be glad to answer you. Thank you for your attention.
Thanks very much, Vitaly, and I'm sure nobody fell asleep in that really interesting overview of these COVID apps. So, an interesting context where we're trying to involve a population in using them. So thank you very much. We're now going to move on to hear a bit more about the patient perspective, and I'm delighted to introduce Kjeld Hansen, who is the chair of the European Lung Foundation, and that's the capacity in which he's speaking today. And he's going to tell us a bit about patients' perspectives, and I think give us some examples and introduce a video from some people living with respiratory disease and using technology. Thanks, Kjeld.
So thank you so much, Hilary. So I'm delighted to be here today, and thank you for inviting me to speak. So my name is Kjeld Hansen, and I'm a severe asthma patient and also the chair of the European Lung Foundation. So today I have two talks to give, and this is the first of them. And my topic now is how digital techniques can improve the lives of patients. So the topic for my second talk will be on digital exclusion. And therefore, you might want to have this in mind when you listen to the first presentation, because it might appear more digital positive than the second, which is on digital exclusion. So both talks will be slide-free, as I aim to communicate an idea of patients' perceptions of barriers and solutions rather than complex information. And at the same time, I would like to liberate you a little bit from the screen. I know that all of us are spending a lot of time facing our screens. So my talk will then focus on 5 different areas. So first, what are the fundamental changes facilitated by digital techniques? Then how does patients in general receive this shift towards digital? 6 different kinds of technologies that have influenced the patient perspective. Recent patient experiences of digital innovation during COVID-19 pandemic. And then lastly, opportunities for developing new products and services for patients. So in general, the belief is that digital technologies can provide a way to help millions of people with respiratory diseases to manage their condition. It can also help, of course, to generate information to help respiratory professionals and other professionals to improve lung health and advance diagnostics, treatment, care, and prevention to the benefits of patients. So this has been a huge shift that has taken place over the past 10 to 20 years. So digitization is when diverse forms of information are then just transferred into an existing structure, while digitalization is more than that, and it can represent both the patients and our behaviors. So to summarize about digitization and the changes it brings, it's both in terms of programmability, which leads to a change of function, convergence, which leads to a change towards homogeneity, and editability, which enables new functions and new contexts, and then reflexibility, which can lead to multi-functionality associations and new functions. So to patients, the digitalization of health is then both a reality and opportunity because digital technologies can be altered and adapted to fit a proposed function. And it can fit the performance and behavior of the patient, and this can happen to a degree which sometimes make the patient's digital profile more real than the patients themselves. So both opportunities and barriers here. The opportunities is that patients can influence the structures, and the barriers is that sometimes the patient will be perceived as their data. So how does patients in general receive this shift towards digital? I think that it's interesting that our network of patients and patient organizations concurrently find that patients fundamentally see digital health as a positive and support the adoption of digital solutions. So some of the examples then include the willingness to use smart inhaler devices if it's made available to them, and the willingness for allowing their confidential health data to be used for service improvements. So the will is there. So what changes are then influencing the patient perspectives? First of all, from the health perspective, we are looking at collaborative platforms where we can share health information and experiences, both in the terms of video, but also in terms of texts. So collaborative systems are allowing patients and professionals to engage and involve themselves more effectively and efficiently. There's also the question of information seeking behavior and asking questions, which is important to patients because it can help shape the output of a service. So shared experiences is also important because some of the knowledge that is being exchanged between patients is intangible, and patients might not realize how important it is and how beneficial it is for them and for others before they have been a part of information sharing themselves. So defining a collective patient perspective through information sharing and experience sharing is then also an empowering tool and a necessity for patients. Another perspective is health apps. So health apps help respiratory patients receive and submit personalized information to help their self-management of their disease. So these need to be better developed with patients and their needs in mind, but they could give people information on the triggers of, for instance, air pollution, pollen, and so on, in addition to helping the patients with the self-management plan. And there are several different examples. Some of them are simply focusing on self-reporting, others on learning and self-management, which also can be designed for kids and youth. And there's also apps that have a wireless function tester plus self-management tools in them. So we heard previously about wearables and how they can help patients monitor their own behavior and body signs. And this is also useful for patients in terms of supplementing the self-management regime. I think, as was highlighted earlier, especially sleep is an interesting area to look at here. And then there are also off-the-shelf gadgets like normal step counters and so on that also have sleep functionality. Of course, as we also heard earlier, there are then also highly detailed monitoring devices off the shelf that are almost research grade. Furthermore, we have smart devices, so we have new tools that can help patients train along and give a digital output of that. And they're tracking use in real time and building a picture of the medication use for patients that are using, for instance, smart inhalers. Remote monitoring is another area of interest, which can help then to better support patients with respiratory disease. And then, of course, there are the back-end systems that could help ensure that those most at risk can have their signals identified and can be helped in time if they're suffering from an attack. So, in terms of recent experiences of digital health innovation during the COVID pandemic, then there are fundamentally happened a change within the last 1.5 years where there's been a huge innovation. In terms of care and consultations, the responses have been mixed, with responses about secondary care more positive than primary care. So patients are still interested in the personal contact. This also represents a change in the way that people are communicating with each other in their daily lives, and a significant change in the way that services are being provided, moving from a traditional in-person model towards a more digital by default. This change in the way that care has been given have happened almost overnight, and it demonstrates also an ability to innovate very quickly. In terms of research, we have seen through COVID that there can be a rapid development of sharing of health research data to understand, for instance, COVID tracing and long COVID and so on. And there's a development of remote monitoring tools to assess respiratory diseases, and then new apps to monitor COVID and support COVID recovery. So in terms of opportunities, then for patients, then it's very important that we can participate in developing new digital products and services. So new technologies need to be designed with a respiratory patient in mind. For instance, a vast majority is developed without sufficient user input, and there's an increased understanding of user behavior for people with respiratory diseases, and these insights can then in turn support the development of new products and services. So we encourage researchers and innovators to engage with patients and patient organizations to inform this development better. And then I wanted to highlight also another development that happened recently, that patient innovation is also happening from the bottom down. So there are now organizations facilitating patients as what you call lead users, patients that come up with their own solution to solving their own problems, and how this can lead to a larger innovation in terms. So finally, I would like to acknowledge our networks of patients and patient organizations who have contributed valuable information and insights which have been used in this presentation. And then to end the presentation, I would like to present a short video where our partner organization, CF Europe, share their experience in real-world data from a patient perspective. Thank you.
We collect data that are important to patients that might sometimes be slightly different from the data that are important to clinicians or researchers or other stakeholders. That's one thing. And the second thing is we collect data in a real world setting, also meaning that we don't only measure things on those specific times that people visit the clinic, but we have a bigger or a wider view on how patients feel and what is important to them across a year, across their lifetime. GDPR is something that we take very seriously. And there are European rules, and then there's country by country also sometimes differences in how to approach this. So for this, we are working together with our national CF associations, so the national patient organizations, to make sure that we do respect all the rules and the framework, both legally, ethically, and to make sure that we don't make mistakes there. But also there, it is a complicated story, and we know, but it is so important to do this and to explore how to best do this. We really want this and are involved that this should be patient-centered, but that doesn't mean that you don't work together with all the other stakeholders. And I am personally very, very convinced that multi-stakeholder collaborations are the best way to move things forward. At the European level, we're now mapping out what's being done already, because of course we don't want to reinvent the wheel. And one of the very nice examples that we know of is our Swedish member organization that does work together with other stakeholders in Sweden.
4 years ago, patients, providers, and researchers in Sweden came together in a coalition to design a system for patient-reported information on exacerbations and antibiotics. We came to the conclusion that the best stakeholder to collect information about this was the patient, and that the information was very important to understand the benefits and the changes in standards of care when new disease-modifying treatments were coming in. Also, antibiotics was considered one of the biggest burdens of treatment for patients and also clinicians. So this was also an area where everyone felt it made sense to work together. Number one is to make sure that there are feedback loops so that patients reporting and clinicians receiving that information have an instant benefit of that sharing. The second is to work with patient-controlled information flows, because it helps all the ethical, legal, and social implications of information sharing when the patient is in control and can give the necessary consents to the use of the data. And the third, which is a tricky one, but is very important and has been a success factor for us, is to really work on the informatics and the information resources and the design so that the information shared between the different systems, the patient app, the healthcare medical records, the patient registries, and then reporting to the authorities can work seamlessly with the same informatics system.
In the future, what we want to do is to roll out what we learned and to support the member organizations in countries where real-world evidence is still not so easy or not so obvious to start working with real-world evidence, to start collecting data as well, and to use that, because we're convinced that if patients are in the center of their data collection, they will be in the center of their care, and their needs will be better understood by all stakeholders, and that will in the end lead to better care, better access to optimal care for all people with CF.
Thanks, Kel. That was really fascinating. And I'm going to pick up on a few words that came from the end of that video about wanting to roll out this technology. And that actually echoes the poll, which I hope some of you have been filling in, about the main barriers to routine use of wearables. And I'm looking at the results now. The top one that seems to be the major barrier is it's not funded or supported by the health system. And the second one is the data data aren't integrated with the clinical systems, and confidentiality follows after that. Interestingly, there seems to be a sense that the data could be useful, but the barriers, it seems to me, there are largely organisational and systems-based, and I think that's really interesting and something that we might want to pick up on. A few more results coming in, which is just echoing that, I think. So we've got a number of questions that we'd like to cover, and I think the first one that would be helpful would be to think about implementation. We've got wearables. Andrea, and I'm going to come to you first. You gave us a wonderful overview of wearables, but how do we get those into the routine care that Kel tells us the patients want? So how do we do it? What are the barriers? How do we overcome them?
Well, the barriers are, I say, mostly accuracy and reliability and user friendliness.
Okay.
And I put in this order because it's not just a question of using a maybe already available device, but first of all to verify the accuracy and the limit of validity of the measurement, the repeatability, and then to allow these measurements for daily use. So no other barriers, I think, present. No other main barriers are present nowadays, apart from, as I try to insist a lot, to overcome the obstacle that is in between a technology already available and a technology that becomes a medical device.
That's good.
That's crucially important. Let me give a very simple example. Pulse oximetry. Pulse oximetry, the technology is available. We have optical system embedded in a lot of smartwatches, for example, or bands, or rings. The point is, how accurate are these kind of measurements to be used for continuous measurements, for example, of oxygen saturation? And only a very small number of such devices are now certified as medical devices.
Okay. Thank you. That's really good. Keld, I'm going to give you a chance to comment now, because we heard that accuracy, reliability, and then user friendliness. Is that the order that you would put it in?
So, yeah, I understand Andrea perfectly well. So I think that's it's very sensible to do that. So from a patient perspective, it's of course the picture is a little bit broader, because we don't rely only on the data that we produce through the apps in managing our system. So there's also a lot of intangible aspects of life and life situations that need to be accounted for when you manage your health. But I would by far prefer that the data is accurate and reliable. So I support Andrea on that.
Okay, thanks. And when we talk about user-friendly, I'm hoping that includes clinician-friendly too. Certainly from my point of view, I want it accurate and reliable, but I also want something that I can actually use. Anita, I think you probably agree, and then I think you've got a question you wanted to pose.
100%, Hilary. Yes, a point I wanted to raise with Vitaly, and that is he showed some lovely pictures of the contact tracing apps, and there was one that you mentioned there and in your references that was really interesting. It was used in Singapore, so the majority of the population there had an app on their phone, but there was a group of the population that didn't have smartphones. They were migrant workers, they were low-income individuals, and they were provided free with wearables, which seemed to be like little key rings. And I wondered if that was a way forward for managing our patients too. It was a really simple wearable. What do you say to that, Vitaly?
Yeah, indeed. So this example I took from Singapore. So according to their data, so they pay attention on the low-paid foreign workers in Singapore and found out that they account only for 18% of total population However, among this amount of population, only 53% of these foreign low-paid workers own smartphones. But they come with over 90% of all COVID cases in Singapore. So they find out that these persons are really vulnerable. And the fact that they don't own smartphone makes them more vulnerable even more. So they created this specific tracking device. It's not monitoring, it's like a special page. And so they provide these people with these devices.
Then we'll give Ioannis a chance to respond to the integration one.
Which lives for more than 4 months, so from 4 to 6 months. And so these people really like the device. So the only we have to care is just check every 6 months to bring this device to get new one with new battery, and just to bring it with yourself where it goes, and like a pager. So they found out that indeed, so patients who do not own smartphones really like these devices. It's simple, and moreover, I mentioned that there are some individuals who don't want to use smartphones for tracking because of this big brotherly theory. So they may use these wearable devices which have no contact with to the internet, so less concerns about this.
Italy, and I love the practicalities of some of these answers. Your word batteries reminded me how when we were trying to roll out some telehealth work in COPD, one of the big problems that we had was that nobody thought how we were going to help elderly people change the batteries on their oximeter, which is a notoriously fiddly thing to do. And that was practicalities really matter. I want to just touch briefly on one other topic that's come up in the questions, and that's around this integration, integrated with clinical systems. But I think I'm hearing, Keld, from your video that you, the CF video, how important it was for the patients that all these different technologies, all Andrea's wearables and apps are actually integrated, and they are not all over the place, lots of different apps to lots of different variables that don't talk to anything or anybody. And I'd really like just a little reflection on how we overcome that another organisational barrier. I'm going to come to you, Ioannis, because I suspect that in elite athletes, where there's perhaps some money pushing behind getting everything together, this may not be quite such a problem, but I'm really thinking in terms of health services, how do we make things integrate?
Yeah, I mean, the example of using specific wearable devices, let's say at home, to deliver home-based rehabilitation is very attractive, because in real time, we may be able to assess several parameters. But interoperability, of course, it is an obstacle at the moment. But big companies these days make wearables which can talk to each other. So starting with these, big companies, probably we will be able to simultaneously assess 4 and 5 vital signs simultaneously. But at the same time, engineers are progressing with interoperability of devices. So eventually, there might be other providers who might be able to unlock the secrets of different wearable devices and be able to integrate it into a single platform and make it available to a cloud portal.
I think this concept, and I use the term plug and play, when I use that, my younger colleagues tell me that that is a very old term and shows my age. But what it meant, I think, was that I could plug it and it would play, and interoperability seemed to, I don't think we're going to move forward until we can solve that problem with all these apps. But I'm not talking technically, I'm talking clinically and as a person, I guess. That's the end of our time. We could go on for a lot longer. It's been a really interesting session, and I really want to thank all of you, Andrea, Ioannis, Vitaly and Keld, for bringing such different perspectives to the discussion. We've now got a lunch break to give us a bit of a rest, and then everybody get away and tidy up their emails and enjoy their lunch. And we're meeting back at 2:30 European time, and the topic then is around communication. So see you all then.